you can't fix a dietary disease with medicine. I might botch that a little bit, but I think that's really important because, you know, a lot of people don't realize that traditional medical system, like the solution in for a lot of traditionally trained practitioners is insulin, more and more insulin. And what happens when you get more and more insulin?
Yeah, the problem is that type 2 diabetes is a really misunderstood disease by the doctors. Then what they don't understand is that they're treating sort of the blood glucose. So the blood glucose or blood sugar is high, so they try and get it down. If you give insulin, well, does that get rid of the sugar? And the answer is no. The insulin takes that sugar and simply crams it into your liver. Okay, and then the liver turns it into fat through de novo lipogenesis or sends that sugar everywhere else. And so the sugar goes into your eyes, into your liver, into your nerves, into your legs, into your heart. And what happens? Well, what happens over decades is that as you keep cramming the sugar from that blood, you had excess sugar in the blood, you never got rid of it, but you took insulin to cram it into your body sort of just blows up with way too much sugar. And then every part of your anatomy just rots. So you go blind, and you get heart attacks, and you get strokes, and you get nerve damage, and you get amputations, you get diabetic foot infections. And it's like, why do diabetics get infections that nobody else in the whole world gets? Why? Because there's sugar. There's so much sugar sitting around in that foot that you get infections like yeast infections that love the sugar. Mm-hmm. And it's crazy because what it means is that type 2 diabetes is essentially being treated completely incorrectly. We're treating the blood glucose. So we know the blood glucose is high because of the type 2 diabetes. But the blood glucose is not the disease, it's the symptom. So if you treat the symptom but don't treat the disease, then you're not going to get anywhere. It's symptomatic treatment. And that's the real problem. We're treating the symptom and pretending like that's the real disease. So yes, we got the blood glucose down. Have you treated the type 2 diabetes with your insulin? And the answer is no. Well, everybody knows that if you lose weight, your diabetes gets better. So insulin makes you gain weight. So your diabetes is not getting better, it's getting worse. And the whole point is that you simply can't take the sugar in your blood and cram it away where you can't see it and pretend you're better. You got to get rid of that sugar. So in essence, the simplest way to understand type 2 diabetes is that there's just too much sugar in the body. The body is overfilled with sugar. Well, if it's overfilled with sugar, then you just got to get rid of the sugar. What do? 1, don't put more sugar in. Eat a low carbohydrate diet. And number 2, burn it all off. And that's intermittent fasting. Mm-hmm. So what we've done is we've taken this dietary disease, and instead of treating the root cause of it, which is the diet, we're eating too much carbohydrates predominantly because we were told to, and we're eating too many times, too frequently. But what we've done is instead of treating the actual cause of it, we tried to drug it. We're trying to drug these people back to health. And we're not treating what was the actual problem in the first place. And then we wonder, why is everybody getting worse? And the worst part is that the answer that most specialists, researchers give is that type 2 diabetes is just like that. It's a chronic and progressive disease. It's like, no. It's chronic and progressive because you treated it completely wrong. The disease is actually reversible. We know that. Anybody who loses weight, their diabetes reverses. We know that from bariatrics. You can take the most severe type 2 diabetic, and within 2 weeks, they'll be off of all their insulin, for example, because they're basically burning it all off because they're fasting. And it's not really hard to understand. If you don't eat, you're going to burn off that sugar. Your blood sugar will drop. If your blood sugar drops, you don't need to take insulin. Mm-hmm. Well, that's not so hard to understand. But now you're dealing with the actual problem of sugar overload, as opposed to trying to give more insulin. So here we have a situation which is sort of mind-boggling, that 99% of diabetics, type 2 diabetics in this country, in this world, are actually being treated, I think, completely incorrectly. And that's why, since everybody's getting worse, the doctors say, well, it's chronic and progressive because I gave them insulin and they got worse. So therefore, the disease must be like that. Yet at the same time knowing that this disease cannot possibly be like that because we just proved it with our bariatric surgery. That we could take this guy, do something to him, which is basically fast him for like 3 months, and make him completely better. Everybody who has type 2 diabetes is reversible except up until the very late stage. That's a fact that we've sort of proven with our bariatric surgery. And it's a fact that we already knew because we know that if your friend loses 50 pounds, he's going to get off his diabetic medication. No doctor is going to say, oh, I wonder why that happened. It's like, well, obviously, right? But so we know this for a fact that it's a reversible disease, yet we pretend it's chronic and progressive because we've been doing such a bad job because we've been using the wrong treatment.
Interesting. When in your career, so you've been practicing medicine for over 20 years, right?
About 20 years, yeah.
And you talk about in the book, like, I know how to make people fat. You know, you're insulin resistant, give them insulin. At what point did you see enough patients gain more and more weight when you were following the standard of care that you said, this can't be right?
Well, it took a long time.
Yeah.
Dogma's very hard to break. And interestingly, it was the patients who all knew. They're all like, you know, you gave me insulin. I'm gaining weight like crazy here. Like, how is that good?
Yeah.
And the answer is it wasn't good. But I didn't know the answer, so I said, well, you know, it's just the way it is. I mean, that's what I said. That's what everybody else said too. But at some point, I mean, it was 2008, 2009 that we started getting some of the data that really showed that giving insulin is not a good idea to type 2 diabetes.